Office treatments for penile curvature, Peyronies disease. UNW Urologic Surgery and Wellness. Call today 941-212-1600 or find us at www.unw.com. Good afternoon, ladies and gentlemen. This is Jared J. Wallen, MD, UNW Urologic Surgery and Wellness, coming to you live from sunny Sarasota, Florida. Another beautiful day, just talking about crooked penises, bent penises, you know, that erection that isn't so straight anymore that it used to be. These are the things we're talking about today. There's typically two different types of clinical pathology that can cause this. One is usually characterized as a curvature that begins from birth, and that's usually a more of a skin tethering problem. The other one typically is an acquired problem called Peyronies Disease, which is basically a situation where either scar tissue builds up on the penis. You'll see the picture up here. Ultimately, you know, those corporal chambers that we talked about, those inflatable cylinders. Again, if you think about this isn't necessarily in the penis itself, but looking at our penis model, you know, ultimately, if we cut down around the skin and even just kind of slide this tissue back, we essentially get down to the erectile bodies, those chambers that fill with blood that create an erection. Remember, we talked about the penis as an inflatable rod. You need good blood flow in to fill it up. You need little valves to trap it there to make it nice and stiff. And those chambers are what determines the erectile length, the penile length, etc. So I know y'all have seen this before. This is an inflatable penile implant. The reality is this would be very similar if I basically filled those chambers with a little silicone cast or something like that. This is what the inside of those chambers would look like. They're essentially a long cylindrical shape that travels the entire length of the penis out to the mid-glans penis. And basically about half of the penis is actually still within inside the pelvis, or half of the erectile bodies rather. And so ultimately you can see that if you have a curvature somewhere along the length of the penis, you know, ultimately that's usually related to some scar tissue development. And it's probably a little bit easier to show you with these malleable implants. These are basically little bendable rods that you can bend up and bend down, and you don't have to inflate or deflate. But you can imagine, you can see that these are curved, and there's two of them here. But you know, you see kind of the maximum point of curvature around here, right? And so that's basically where the little scar tissue deposits. And you can see up in this area here on the picture that's where the little scar tissue plaque is. And basically what happens with that, it limits the ability of that tissue to expand when inflation occurs, when the blood comes into the cylinders. And that allows the bottom portion to continue expanding because there's no scar tissue there, but there's actually scar tissue on the top. And so that limits it. And so then ultimately you end up getting curvature in whichever direction the scar tissue is. Curvatures can be pretty bad. They can be, you know, 90 degrees or worse. They can be, you know, about 45 degrees, they can be 20 degrees, etc. The biggest two things that come in mind when we talk about treatments for Peyronies disease or penile curvature or bent penis, etc., whatever you want to call it, are what your erectile function is, so how strong, how rigid the erection is now, and how bothersome it is for you, as well as the degree of curvature. Again, you know, 90-degree curvature is much different than talking about, you know, a 20-degree curvature that really doesn't limit your activities. The whole goal with these types of treatments are to keep you functional. So keep you rigid and also try to get you as straight as possible. We may not always be able to get back to 100% straight, but to get you as straight as possible so that way sexual activity is not bothersome for you or your partner. Ultimately, from that standpoint, you know, the reality is that there are some non-surgical options, you know, especially if your stiffness is preserved. The most common non-surgical option is a little injection of a medication that goes directly into that plaque. And so, you know, basically we kind of stick down through the skin and basically squirt some medication into that area where the plaque is to basically deliver the medication to that area. That medication is actually an enzyme that basically breaks down scar tissue. And so that basically softens that area of scar tissue to allow it to kind of expand and contract again like it used to. Commonly, that's done in combination with what we call traction therapy, which is basically where, you know, ultimately you would essentially kind of stretch the penis along the length of it, but you would also kind of bend the penis in the opposite direction of the curvature. So if you had, curvature 45 degrees upwards, we would do your injections on certain cycles, and then we would have you do some stretching exercises to kind of gently try to stretch that out and straighten it out, to get it back to more normal parameters. Obviously, that enzyme that breaks down the scar tissue can certainly cause some softening to the point where that little fascial layer can, certainly have a little break in it. Most of the time, that's a non-surgical problem and basically just requires a few weeks of healing. And so to review the stretching exercises, you want to do these each for 60 seconds, about 2 to 3 times a day. Ultimately, what you want to think of this as is stretching as you're warming up before you're going out for a jog. You don't want to overdo it, but you want to get the tissues nice and limbered up a little bit if you can. And so ultimately, the first one is on the left-hand side of the screen. You want to grasp with your whole hand behind the head of the penis and just pull straight forward away from the pelvis. And again, do this for 60 seconds and release. The second exercise can be seen on the right-hand side of the screen. The blue-shaped area on the bottom portion of the phallus is basically a support fulcrum that you want to counteract the maximum area of your curvature. And so you want to support that with 2 or 3 fingers, and then you want to push the rest of the penis, again grasping at the head of the penis and bending in the opposite direction of your curvature. Again, holding this for 60 seconds and releasing. Again, both of these should be done 2 to 3 times a day. The stretching exercises and the injections can be done together or by themselves as a standalone treatment. Thank you so much for watching our video. Here's a list of our website and social media channels. If you liked our video, like and subscribe and share it with your friends. And ultimately, let us know how we can help you.